Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, May 30th. You're now watching Open, a live program bringing the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Across the country, organizations acknowledge May as Mental Health Awareness Month. The National Alliance on Mental Illness NYC is one of several organizations honoring the effort. Joining me to discuss mental health awareness is CEO Matt Kudish and Director of Policy and Advocacy Kimberly Blair. Thank you both so much for joining me.
Thanks for having us.
Now, I want to jump in just talking about your organization as a whole. So, can you tell us a little bit more about it and the mission?
Yeah, our mission is to help families and individuals affected by mental illness build better lives through education, advocacy, and support. We offer peer-led programs, which means that the programs you're participating in are taught by people living with mental illness themselves, and just as importantly, by family members and friends of people living with mental illness who understand what you're going through because they're going through it as well.
I really like that you mentioned that. I've noticed that a lot more organizations are doing that. Because I think sometimes in certain situations like that, you could fear that maybe you're being judged, and I think it's so amazing that it's like a peer thing. So it kind of eliminates that fear. So thank you so much for sharing that. Now, how does mental illness impact New Yorkers specifically?
So the statistic is that 1 in 5 of us is living with mental illness. I think that only tells part of the story. 1 in 5 of us is living with mental illness. The other 4 are our family members, our friends, our colleagues, our social networks, our neighbors. So we're all impacted by mental illness in one way or another. If left untreated, mental health issues can cause some serious problems for people. You might see challenges in relationships. You might see people becoming more isolated and experiencing more loneliness, which we know can lead to other serious health outcomes. You may have difficulty completing your education. You may have a hard time getting and keeping meaningful employment or housing. So the consequences of living with mental illness, especially untreated, can be pretty significant and just as impactful on family members. So very often we think about mental illness as the person living with it, but we have to remember the people around them who love them and want them to do well and have the best life possible. Mental illness can be so isolating for all of those people, the individual living with it and their family members and friends. So we want to make sure that people are connected to community so that they understand that they're not alone.
Now, I want to take a moment to just highlight the Bronx in particular. As many of us know, the Bronx is like the highest when it comes to like everything bad and the lowest when it comes to everything good, which is like kind of an unfortunate reality. Can you talk about how you've seen mental illness, affect members of the community in the Bronx?
Yeah, the Bronx actually has the highest level of inpatient psychiatry in the city. And I think when we think about access to mental health care, we know that there are fewer psychiatrists in the Bronx than in other boroughs, and significantly. We know through an access perspective, you have to, very often it's about insurance. And so if you have insurance, are you covered for mental health benefits? If you don't have insurance, are you able to afford out-of-pocket mental health care? And in each case, is there someone available right now who can help you when you are dealing with these issues, or do you have to wait for a really long time? I think another piece of the way that this issue affects the people in the Bronx specifically is when you are talking with a mental health professional or even peer programs like ours, you want to talk to someone who looks like you, who shares your experience in some way. You don't want to have to explain what it's like to be a Black person to a non-Black person who is there to help you. And I think the last thing I would say about the ways in which the Bronx is affected by mental health issues is unfortunately a much higher increase in dealing with the criminal legal system. So very often Black and brown individuals end up being shot and in many cases killed, unfortunately, by the police when they are not doing anything wrong other than having a mental health crisis. So it's really important that we start to address these disparities in the Bronx, but certainly across the city.
If I may.
Yes, of course.
I also would like to just add that, as someone who used to live here for some time, what does that look like, right? What Matt is talking about, that lack of cultural competency and that lack of linguistically appropriate care. For me, it meant traveling up to an hour and 30 minutes on the train to Brooklyn, to the one provider that I had established a relationship with who really understood my culture, which is really such a shame because we have such a diverse population here, and we do have a lot of BIPOC representing providers, but the wait list is just so long, and especially to that point that Matt said, that affordable option. So sometimes I just like to always bring that personal experience because I think it's really important to show what it looks like.
Now, if you can, can you talk about, the top policy priorities and, what is going to be done just to help Bronx, people who are impacted by mental illness or worrying about their mental health?
Yeah, definitely. So we do a lot of work on the city and state level. We work with city council. We work with state legislators, such as your state assembly members and your state senators. And all that is geared towards increasing access, making sure that everybody has access if they're underinsured or uninsured, right? We always talk about uninsured, but never underinsured. Sometimes some of our benefits don't include mental health services, right? Or out of network, which a lot of providers are here in New York City. In addition to access and making sure that we have initiatives with workforce development to really cultivate those BIPOC mental health professionals that we really need. We focus a lot on family support. It's the first time ever we're included in the City Council mental health roadmap, and there is a commitment to fund family support services. So that means that family support and how to understand mental health, how to cope within the family unit and support a loved one who lives with mental illness. So we have a financial commitment from the City Council. Aside from that, we do a lot. We do a lot of decriminalization of mental illness work. That's really important as we see a long wait time for people who have an established diagnosis. Waiting in pretrial detention, sometimes at Rikers, sometimes in other local jails, and they're deteriorating while they're waiting, right? Because there is no diversion, there's no off-ramps. So we focus a lot on activism with the TNJ Act, that stands for the Treatment Not Jail Act. It's at the state level, but we do garner a lot of city support for that state legislation to push. We've been working diligently on what would it look like for the state to finance more mental health courts, more drug courts as diversions for people who have contact with the criminal legal system. And so aside from that, that's just one diversion, right? But there are a number of other things. We really focus on non-police response to mental health crises. We focus a lot on calling for a Be Heard oversight hearing because while it is a step in the right direction with Be Heard, and it's a first step towards a true non-police response, it's not currently in its current iteration working up to the community standards for non-police response. We still have the police responding up to 82% of the times, and they utilize 911 instead of 988, which is a 3-digit crisis line. So we work on all that, and then also supportive housing, making sure everybody has access to supportive housing for mental health conditions.
I wanted to touch on that because I noticed that I did a story a while back just about how, members of, people who are dealing with mental illness, sometimes the family members will call the police because they don't know, what to do. Are there any services or anything that you offer to help people also deal with that? Because I think a lot of people I think mental illness just in general isn't, we're not educated on it a lot. And so a lot of people could mean well, but, maybe they'll still call the cops because they don't know who else to turn to. Is there anything that you guys do to help people dealing with that?
Well, we're not born knowing how to, as you said, we're not born knowing how to navigate something as complicated and complex and sometimes off-putting as mental illness, both in ourselves or in someone that we care about. I think the 988 number that Kimberly mentioned is really important for people to understand. If you're not sure what to do and you need help, calling 911 will very, very likely bring a police response. We want to avoid that as much as possible. We want a mental health response for people who are having a mental health issue. And so 988, which was launched nationally last July, is a really great resource for people to call, to have EMTs and social workers come. We believe that there should be peers who are a part of that. We think that people with lived experience, both living with mental illness and family and friends of people living with mental illness, who are trained to support other people going through similar crises, can add a valuable component to de-escalating a situation and supporting all of the people who want that individual to be well. I don't know if you want to add anything.
So we always want to get the message out about 988 because the more people utilize it, the more we could also fix the little kinks that we're trying to fix at the national level. So something to note, if you are a New York City resident, you have a New York City area code, you dial 988, you will be transferred immediately to the call center, which is run by NYC Well. Okay. But if you have a non-New York City area code, we do ask people to use 188 NYC Well. That way they're still connected directly because as of now, they're using area codes to kind of connect you to your call center. And the great thing about NYC Well is when we're focusing on like bringing peers to the forefront, NYC Well has clinical specialists that pick up the phone as well as peer specialists. So if you call, they do that triage to make sure you're stable, right? That you're not suicidal. But after that, you can actually request for a peer specialist if that's not who already picked up the phone. So I think that's really important to know.
And I'm so glad that you shared that. I definitely learned a lot because this was not something that I even heard of before. So I'm so glad that you shared that so that people watching can know what to do. Now, can you just talk a little bit more about like how can New Yorkers get involved in advocacy work? If this is something that they're passionate about and they want to help out more, what can they do?
Yeah, this is my favorite part. So we have an advocacy ambassador program. It's all made up of people with lived experience in some way. So peers, either someone living with a mental health condition, family members. We have some friends as well who are doing this in honor of, like, let's say a loved one who died by suicide, right? And we have a smaller number of clinicians, but all of them also have some lived experience in some way firsthand, right? And so we train them and mobilize them to speak to their city legislators and their state legislators, and they have those one-on-one connections themselves, and they really lead the efforts in our policy areas. Additionally to this, we have advocacy town halls. We have one this Thursday online, so it's accessible to everyone in the Bronx, right? It's at 6:15. It's called Thriving Through Pregnancies. It's really talking about the intersections of reproductive psychiatry and policy. And we're going to have State Senator Samar Brook, Assemblymember Ferris Forrest, and some big reproductive psychiatrists on there talking and breaking this concept down. In July, we're going to have a BIPOC Mental Health Month event. So that's something to look forward to.
And it's so important because I think like mental health affects different communities, you know, separately. And like, you know, what one person is dealing with is going to look completely different from, you know, someone of a different background. So I'm so happy to hear that.
Yeah, and really, if you want to get more involved, you can come to our website. On the advocacy page, there's an application, and as long as you live in one of the 5 boroughs, we do some screenings, but for the most part, that's really the main threshold. We really, all of our services are really no barriers to entry, and it's really important that we highlight that, not just the advocacy, but the peer support and family support services that we run.
I want to make sure everyone knows that all of our programs and services are available free of charge to anyone who needs them. We don't care about your immigration status, your insurance status, NAMI-NYC.org. There's no reason not to check us out if you're living with mental illness or if you care about somebody who lives with mental illness.
Well, I want to thank you both so much for joining us. Thank you so much.
Thank you.
Thank you.
Don't go away. We'll be back with more Open right after this.